Anencephaly is a serious birth defect wherein the skull, scalp, and brain of the baby does not develop properly inside the womb. Part of the skull and the brain are missing, and the brain tissue that does form is actually exposed because there is not enough skin and bone to cover it. Now, birth defects in the nervous system, like anencephaly, are neural tube defects, and this happens very early on in the pregnancy. And based on the latest study in anencephaly in 2021, it was shown that anencephaly happens in 1 out of 4,600 pregnancies, and they affect more baby girls than baby boys. And though most pregnancies with anencephaly end up in miscarriage or stillbirth, those babies born live may actually die within a few hours or days from being born. Now, although studies have shown that this is not something that is inherited, you having a previous pregnancy or a previous child with neural tube defect may increase your chance of having another baby with anencephaly. And the cause is usually a combination of environment, genes, and nutrition during pregnancy. So what are the medications or lack of it and risk factors that may actually increase your chance of having a child with neural tube defect or anencephaly? Number 1 is lack of folic acid. Intake of anti-seizure drugs that are also sometimes given for those with bipolar disorders like valproic acid, phenytoin, and carbamazepine can also actually increase your chance of having a baby with anencephaly. Now, taking opioids, especially during the first 2 months of your pregnancy, can also increase your risk. Now, uncontrolled diabetes is another factor, as well as obesity. And finally, certain studies have shown that high temperatures or like having fever or using a sauna during the early part of your pregnancy may actually increase your chance of having a child with NTD. However, there is limited study to prove this point. Unfortunately, it cannot be treated, but we can actually do some preventive measures. Number 1, is taking folic acid at least 6 to 8 months prior to the planned conception date. Number 2 is avoiding medications or taking a lot of medications or drugs, And number 3 is making sure that you're healthy even before you get pregnant. So you work with your doctor, take the necessary vitamins, and make sure that you lose weight if you are overweight, and control your sugar if you're diabetic.